National health insurance in Korea. Full guide for foreigners. Intro. If you are a foreigner living or working in Korea, national health insurance is mandatory, not optional. But who must join? Who can be exempted? How much do you pay and what benefits do you get? Today, I'll explain Korea's national health insurance system for foreigners, clearly and simply. Section 1. What is national health insurance? Korea's public health system is operated by the National Health Insurance Service, also known as NHIS. Foreigners enrolled in NHIS receive the same medical coverage as Korean citizens, including hospital treatment and surgery, diagnosis and rehabilitation, childbirth-related care, preventive and health promotion services. Section 2. Employee insured. If you work in Korea, if you are a registered foreigner or overseas, Korean and work for a company in Korea, enrollment is compulsory. You are considered an employee insured if you are registered with the immigration office. You work at a workplace covered by NHIS. You are a public official, teacher, or private school staff. Important. If a self-employed business hires a foreign employee, the employer must voluntarily report employee enrollment to NHIS. Section 3. Contribution for employee insured. Your monthly insurance contribution is calculated as monthly contribution, monthly wage x contribution rate. Employee pays 50%. Employer pays 50%. Premium is automatically deducted from your salary. Applied retroactively from your employment start date. Section 4. Exemption from employee insurance. Very important. Some foreigners may apply for exemption from NHIS employee coverage. You may apply if you already have foreign insurance providing equivalent medical benefits. Your employment contract provides equivalent medical coverage. Legal basis. Enforcement Decree of the National Health Insurance Act, Article 76. Enforcement Regulation, Article 61. How to apply. Submit the employee health insurance withdrawal application. Must be submitted within 14 days of enrollment. If approved, the eligibility acquisition date becomes the loss date. Late submission may result in retroactive premiums. Section 5. Self-employed insured mandatory. After 6 months, if you do not work for a company but have stayed in Korea for over 6 months and hold an eligible visa, you must enroll as a self-employed insured. Mandatory since July 16, 2019. Contribution calculation. Same method as Korean residents, based on income, property, and household score. If calculated premium is lower than average premium applies. Section 6. Eligible visa types. Most long-term visas are covered, including D visa students, training, religion, intra-company transfer. E visas professors, teachers, professionals. F visas F2, F3, F4, F5, F6. H visas working holiday, visiting employment. D2 and D4 visas had temporary deferrals in the past, but are now generally subject to NHIS. Section 7. Dependents' family members. Your family members may be registered as dependents if they are mainly supported by you. They meet income and property requirements. Income requirements. Total annual income under 20 million KRW. Special rules apply for disabled persons and veterans. Property requirements. Property tax base under 5 and 40 million KRW. Higher limits allowed with lower income. Eligible dependents. Spouse. Parents and grandparents. Children and grandchildren. Unmarried siblings, age and condition limits apply. Documents required. Alien registration card. Family relationship certificate apostille required. Korean notarized translation. Section 8. Premium reductions, good news. Some foreigners receive discounts. 30% reduction. Religious workers D6, humanitarian visas G1, students D2, D4, F4 students. 70%, 60%, 50% gradual reduction. Island remote area residents up to 50%. Farming and fishing villages 22%, 28%. Households consisting only of minors are excluded from discounts. Section 9. Paying as a family unit. You may request family-based billing if annual household income is under 3.6 million KRW, household assets are under 135 million KRW. Submit family relationship documents to NHIS for combined billing. Section 10. Insurance benefits. same as Koreans. Once enrolled, foreigners receive medical treatment, hospitalization and surgery, childbirth benefits, preventive health care, no reduced coverage, no discrimination. Outro contact information very important. If you are confused about NHIS enrollment, employee versus self-employed status, exemptions or premium reductions, you don't have to figure it out alone. Byung Chun, Dorotel 32320625. Byung Digiwo Facebook. Come Expat Insurance. I help foreigners in Korea understand health insurance, auto insurance, and expat insurance clearly, honestly, and correctly. Feel free to contact me anytime. Closing. National health insurance is not just a legal requirement, it is your safety net in Korea. If this video helped you, like, subscribe. Leave your questions in the comments.